Hello, everyone. Good evening. Good evening. Good evening. Good evening. Coming. Good evening, everyone. If you're watching this, can you hear me? If you can hear me, can you just give me a sign in the comment section? If you're hearing me, if you can hear me, can you give me a sign in the comment section? Let's see. If you can hear me, let me see a comment in the comment section. If you can hear me, let me know in the comment section. You're welcome to this live health related question and answer session with Dr. Promise. Okay, so can you hear me? All right, thank you so much. Somebody can hear me, and that settles it. Okay, so we are going to start right now. We're going to start now. All right, thank you. You can hear me loud and clear. That's good and fine. So it's I hope we have people here or people online who will ask questions concerning their health, and by God's grace, I'll try to be able to answer them to the best of my ability. All right, so before we start, let's just say a word of prayer. Our Father in heaven, we thank you so much for bringing us here this evening to this session. We bless your name for the activities of today. We glorify you. We say all glory, honor, power, and adoration be given unto you in Jesus' name. Lord, we pray and ask as we carry out this live session, I pray, O God in heaven, that your spirit of wisdom will rest upon me and rest upon each and every one of us who are partaking, including those who will be asking questions, including I who will be answering. I pray, O God, that you give us your spirit of wisdom. And in the end, we'll have the cause to glorify your name. Thank you, Lord, for prayers answered. In Jesus' name, amen. So, once again, welcome, Watchman Young Adults Forum. It's a health session. I don't really have anything to say. I'm just here waiting for you to ask your questions. I'm here waiting for you to ask your questions. You can ask your questions in the comment section. If I see your questions in the comment section, I'll answer them here. You can also log in through the link that was posted. If you log in through the link that was posted, I'll also see your questions and I'll read them out. All right, so I'm here. Ask the doctor any question related to health. Any question related to health. Today is the day. Ask your question, any question related to health. I'll be waiting for you in the comment section. I'll be waiting for you to log in through the link I shared. What are the questions? Let me have them. So what are your questions? If people don't have questions, is to end the session quick. It's good that people don't have questions, so they don't have anything. They don't have anything bothering them. So I'm waiting for you in the comment section. If you have anything to ask me concerning health, a health challenge in your family, in your body, wherever. Um, I'm waiting. Okay, somebody's still typing. Okay, I'm waiting for your questions and I'll try to do justice to them. Okay, I'm still waiting. Nobody, no question. Okay, nobody has question. This is wonderful. That means nobody will come to my inbox to ask me any question on health. That is what it means, because if you cannot ask your questions now, maybe in the comment section, or you log in through the link I provided, that means you're okay and you don't have any issues. So someone is asking a question. I usually fall sick. Okay, let me show it. He or she says, I usually fall sick when it rains and I plan or I dream to travel to Russia. Please advise how to overcome it. How to overcome it. Okay. All right. For this person, you need to understand the weather around you. You usually fall sick when it rains. So you need to understand the weather around you. Okay. Understand the weather around you, and you need to look out for why you fall sick when it rains. Why do you fall sick when it rains? Why do you fall sick when it rains? You need to look out for that. Is it that um, when it rains or during rainy season, there is usually proliferation of mosquitoes? Okay, are you prone to mosquito bites? You need to check that out. Okay, are you prone to mosquito bites? Russia is a cold place sometimes, but as at this period, what they have in Russia now is summer. Okay, it's a hot period. So Russia is not always cold. Okay, so you need to find out the reason. Check your environment. Is it the water you drink? Are you prone to mosquitoes? If you're prone to mosquitoes, especially during rainy season, okay, you need to protect yourself. All right, how do you protect yourself? Get what's it called? Mosquito net. Okay, mosquito net can protect you against malaria. Okay, mosquito net can protect you against malaria. That is, perhaps you're having malaria. Who knows? So mosquito net can protect you against malaria. What else? There are also preventive medications that can be given or that can be taken by people to prevent malaria. Okay, all right. So also some people get sneezing, they feel cough, they feel catarrh, they feel fever, okay, especially during cold weather, during cold season, okay. At such a time, there are drugs you take to reduce the symptoms. So when you say you usually fall sick, I don't really know what the symptoms are. So if you can make me know what symptoms you feel when you fall sick, I think that will be good. Okay, so I'm still waiting for more questions. I'm still waiting for more questions, more questions. I'm still waiting for your questions. Wow, if there is no question, then by 8:30 we'll just close this session quickly. Okay, so I'm only here to answer your questions. I'm only here to answer your questions. For the person who falls sick, okay, for the person who falls sick when it rains, okay, you can overcome it. Try and protect yourself. check the water you drink. If you're the type, people's bodies are different. If you're the type that leaves your body open, okay, when it's cold, you try and see how to cover your body. You try and cover your body very, very well. Okay. Another question is in. I'm going to show it on the screen. His sister always experiences back pain a lot during that time of the month, and it really keeps her down and unproductive. Okay, what do you advise? Okay, by that time of the month, I assume you mean during her menstruation. Yeah. Okay, I assume you mean during your menstruation. Um, I'll need to. Okay. Let's see. So it's not uncommon. It's not uncommon to experience pain for women. For some women during menstruation, it's not uncommon. Okay, when I say it's not uncommon, I mean it's common with some women. We advise at such a time those kind of people take on, they can go on analgesic such as paracetamol. Okay, such as paracetamol can be taken maybe once or twice. Okay, if it is severe, that is, you're experiencing serious waist pain. Okay, you're experiencing serious waist pain, then you need to check with the doctor. If it is so severe, if it is so serious, okay, if it is so severe and so serious, then you need to check with the doctor. If it is not so serious, I advise you to take paracetamol. Listen, the pain will be there. I hope you know what happens during menstruation. Although some people experience pain, some people do not experience pain. So, to explain what happens during menstruation is that the layer, okay, of the womb is being, something is peeling. Okay, the part of your womb that was prepared during your cycle, okay, is peeling and falling off. So that's what happened during menstruation. So you feel pain. So I advise you, okay, to, if you can also get a warm massage, okay, massage your abdomen, lower part of your abdomen and your back, okay. I believe that with time, and also you'll be fine. Also, if this person that is experiencing this is unmarried, usually when you get married and start giving birth, uh, this painful menstruation will stop. Okay, so sister who always experiences back pain a lot, it's not out of place if you take if you can go with the usual what's it called, with the usual pain reliefs, but don't take it so much, just one or two tablets and you are okay. Another thing is, when you're getting close to your menses, for some it works, for some people, avoid what's it called, sugary stuffs. Okay, avoid sugary drinks. If you're not comfortable with sending your questions on the comment section or logging in through the link, you can private chat me. Okay, you can send me your questions privately and I'll attend to them. Okay, attending to them means I'll still read them out. Okay, so this sister who experiences this, I want you to ensure that you do not take sugary stuffs, especially when it's getting to your menses. When you know you're going to see your period, avoid sugary drinks, because sugary drinks worsen it, okay, makes you have more pain. So during that period, avoid sugary drinks. Before that period, avoid sugary drinks. During the period, avoid sugary drinks as well. All right, so I hope I've attended to you, but if you're not satisfied, you can still ask more questions. Okay, so I'm still here waiting for you to ask your questions if you have any. I'm still here waiting for you to ask your questions if you have any. I'm still here waiting for you to ask your questions if you have any. Okay. Health, they say, is wealth, and you have been given opportunity to ask anything that is bothering you in health. I think you're supposed to take advantage. I think you're supposed to take advantage of it. Okay, I think you're supposed to take advantage of it. And all right, so another person drops a question. Okay, the question goes like this. I hear a lot. Okay, let me make it show. I hear a lot of kidney problems these days. I'm afraid. Please, what are possible causes and prevention? Thanks. All right, thank you so much for that question. And that's the truth. Young people these days are having kidney diseases, kidney failure. Okay, very, very important. So, number one thing that can cause kidney problems is lack of water. I used to talk about drinking water a lot. Many people don't drink water. Okay, many people don't drink water. Let me tell you, the kidney, there are two organs, and they are the kidneys at the back. The kidneys are responsible for filtering poisonous chemicals or poisonous substances from the body. All those things you pass out through the urine. Okay, they are poisons. Okay, so the kidney helps to filter them, take them away. All right, that's why the kidney is there. And so if you don't drink enough water, when I say enough water, for the females at least, for the males rather, you have to take at least, we are to take at least 8 sachets, okay, 8 sachets of pure water in a day. Keep posting your questions, I'll answer them. For the males, you're supposed to take at least 8 sachets of water in a day, while for the females, at least 7 sachets of water in a day. So if you don't drink water, in the morning, you wake up, you take water. If you don't take enough water in a day, okay, you are going to get yourself prone. You are predisposing, you're exposing yourself, okay, to kidney failure. You're exposing yourself to kidney problems. Not drinking enough water can cause what we call kidney stones, okay, can cause kidney stones. And people who experience kidney stones, they find it painful when they urinate and all that. So that has to be taken care of. Another thing is alcohol consumption. Okay, consumption of alcohol can destroy the kidney, can make the kidneys ineffective. Okay, so I've talked about lack of water, one, taking of alcoholic substances, two, can destroy the kidney. Another thing is uh, what we call drug abuse, abusing certain drugs. There are drugs you just stay, nobody prescribed them, you just walk up to the chemist to buy them. Which doctor prescribed these drugs for you? No doctor prescribed the drugs for you, but you just take them. If you continue taking those drugs, if you, especially when you take them for a long time, they can predispose you to kidney issues. Okay, you can have kidney issues. So that is a cause. Another thing is urinary tract infection. People who have untreated urinary tract infection. If this infection is untreated, left to stay for a long time, complications happens, and such people may in the long run develop what? Kidney problem. Another thing is hypertension. Okay, high blood pressure can cause kidney problem. Another issue that can cause kidney problem is diabetes. Okay, diabetes or excessive sugar in the bloodstream can cause what? Kidney problems. All right. So another thing, very, very important, is the abuse of herbs. People take herbs. Okay, your mother buy you're sick, you go to buy agbo. Hmm? You're sick, you go to buy agbo. You're sick, maybe your mother bought it, your father bought it, your grandfather or whosoever, or maybe you're even making it in the house. You expose yourself to kidney diseases. All right, your kidney may shut down, okay, because you are pumping yourself with unquantifiable amounts of herbs, okay, unquantifiable amounts of herbs. And these herbs, when I talk about, I've called, what's it called, I've used agbo for an example. Okay, I don't know what agbo contains, but people say they take it and they get fine. But if you do this, if you continue to take them, you will cause problem for yourself. You will develop kidney failure. Okay, so taking agbo stop taking agbo. Okay, don't allow anybody to buy agbo and give to you, and you also should avoid taking it. If you see where they are preparing it, please run away from that place. That's how to prevent it. Okay, so drink water. That's prevention of kidney problems. Drink water. Number one, avoid alcoholic substances. Anything that contains alcohol, avoid. That's number two. Number three, ensure to maintain normal blood pressure. For people who have blood pressure issues, ensure to take your drugs. All right. For those who have diabetes, okay, they have to ensure that they have their blood sugar checked and their drugs taken in the correct amount. Okay, and then avoid taking, unsolicited drugs. Avoid abusing drugs. Okay, avoid abusing drugs. If you have any form of urinary tract infection, you have pain when you want to urinate, you discover that you have pain. Okay, you discover that you have pain when you want to urinate, or itching, burning sensation for the women, burning sensation when you want to urinate, burning sensation when you want to urinate. You'll discover that if you go to the hospital and check, it may be a urinary tract infection. If left untreated for a long time, it can cause kidney issues. So ensure to do what? Go to the hospital, get treated. Don't go to the chemist to tell chemist to prescribe drug for you, because you will be spoiling, or you will be damaging yourself. All right. So I hope I have done justice to this question. Kidney problems, they are very, 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 very real. Okay. There are some other things that can cause kidney issues, like malaria. A specific kind of malaria can cause kidney issues. So, any other questions? Any more questions? If there are no more questions, maybe we can end this session at 8:30. If there are no more questions, maybe we can end it by 8:30, maybe. Or if I see questions, I'll continue. Okay. So please, everybody, take water. Take water. Take it very well. Don't pity. Okay. The highest thing is that you will pass out urine. When you urinate, you are protecting, as in your body is washing itself. Your kidney is washing itself. Okay. Drink water. Drink it very well. Drink water, drink it very well. Drink water in the morning, drink water in the afternoon. At least, if there's nothing that you're hearing from me, please understand, men at least take 8 sachets of water in a day. 8 sachets of water in a day. For those who use pure water. For the women, at least 6 sachets of water. You can drink more than that, but let it not go below that. All right. So, any other questions that you would want me to answer? Bring your health questions, not a few. Bring your health questions and let's see how we trash them. Bring your health questions. Let's see how we trash them. Bring your health questions. Let's see how we trash them. All right. So drink water, please. Drink water very, very well. Very, very important to protect your kidney, to protect yourself. Try and ensure that you take water. Take water. Take water. Take water tonight. Take at least 2 sachets of water tonight. Okay? Take at least 2 sachets of water tonight. All right? Before you sleep. It's your kidney. Your kidney will take care of itself. Ensure to do that. It's a healthy practice. Okay? It's a healthy practice. So I don't know if there are any other questions in the comment section. Okay, no other questions. Ask your questions in the comment section and I will answer them accordingly. Ask your questions in the comment section and I will answer them accordingly. Ask your questions in the comment section and I will answer them accordingly. Okay, so if there's no more question, I'm going to end the session by 8:30. Okay, I'm going to end the session by 8:30 once there is no other question. So I'm waiting for your questions. Good evening, good evening, good evening. I'm waiting for your questions in the comment section. If you have any questions on health to ask, drop them. But if you don't have, no problem. Someone is asking, is menstrual cramp normal? Is menstrual cramp? Yes, it's normal. Okay, menstrual cramp. Menstrual cramp is normal. Very, very normal. Okay, and if you don't have it, it is not abnormal. Like I said in the beginning, menstrual cramp is caused by the falling away of the walls of the womb. Okay, the things that we are prepared, the things that we are prepared during the cycle. Okay, especially during the cycle. So when you're menstruating, those things are peeling off. Okay, there is something, I can't give the medical explanation here now because you really understand me, but I want you to understand that the peeling of the womb, okay, falling out as the menses, they are pain mediated. Okay, they are pain mediated processes, so you will feel some pain. The menstrual cramp is normal, all right, but for some people they have developed themselves, not that they don't feel pain during their menses, but they have developed themselves to the extent of the pain does not affect them. The pain will not affect them so much. Okay, and you're asking a question again. Most ladies experience this. What's your advice concerning menstrual cramp? Like I said earlier, I said during the menses, during the period, before your period, try not to take um, before your period, try not to take sugary substances. Before your period, try not to take sugary substances. It's some studies have shown that ladies who are used to having menstrual cramps, and then they take it again, take sugary substances like Coke, okay, like Fanta, like sweet biscuit during their menses, they will usually experience pain. Okay, they will usually experience pain. So I said stay away from sugary substances before your menses and after your menses. Okay, sorry, before your menses and during your menses, stay away from sugary substances. It's gonna help you. Also, still to help pain, paracetamol is fine. Paracetamol is fine. Okay, now it must not be paracetamol. Only one tablet of what's it called? Just one tablet. One tablet of ibuprofen can stop, can just reduce the pain. Okay, just one tablet of ibuprofen, 400 milligram, can reduce your pain. If it is so serious, if it is so severe, if it is so much, like if you're experiencing serious pain, please see your doctor. Okay, get to the hospital. All right, if the pain is so much, get to the hospital and the doctor will take care of it. Okay, somebody sent me a private message here. She said, please, it's concerning my dad. I'm going to be reading it. He has been sick since February last year. The illness was diagnosed as prostate cancer. Okay, the doctor in charge of prostate prescribed drugs. He took them, but all to no avail. So he underwent prostate surgery. Um, so he underwent prostate surgery, that is removal of the prostate. Okay, she wrote testis here last year, October. The surgery went successful and there was improvement. Earlier this year, January precisely, the illness started all over again. This time around, he suffered from headaches. Okay, this time around, he suffered from headaches. He has taken drug all to no avail. Okay, for prostate cancer, first of all, I'm going to say here that when men, there's a gland called prostate gland. Okay, it is at the base. Let's say this is the penis. The prostate gland is somewhere around inside. Okay, somewhere around inside, just a very small organ. Okay, it's called the prostate. As men get older, as men increase in age, the prostate gland tend to, for some of them, the prostate gland tend to increase in size. Okay, and when it increases in size, it will now block the passage of urine. And when it blocks the passage of urine, you hear the men in their 50s, in their 60s, you hear them complaining of difficulty or painful urination. They feel pain when they urinate, and or they want to urinate, they have to take some time in the toilet as they urinate. Okay, so those men, it may not be prostate cancer, but we'll call it benign prostatic hyperplasia, meaning that the prostate has enlarged in size, if that is the diagnosis. So for this patient, or for this person who has had prostate cancer, you should understand that prostate cancer spreads. Okay, prostate cancer spreads. Prostate cancer spreads if it is not attacked on time, if the right drugs are not given, if the surgery is not done quickly. Prostate cancer can spread, and when prostate cancer spreads, it can affect the bones, it can affect the blood, affect different parts of the body. So even if the prostate was removed, or the testis was removed, maybe the cancer spread towards the what's it called, towards the testis, and and it was removed, you need to it's very, very important. You said the surgery was successful, but I want you to understand that he has to go for follow-up. Okay, the person who asked the question, your dad has to go for follow-up. You say he's suffering from headaches. If he's no longer, he has to go for follow-up, and more tests has to be done. Okay, more tests has to be done for you people to know if he is still having the cancer, the prostate cancer or not. Maybe the prostate cancer has spread to one part of the body and he does not know. So I encourage you people to go to the hospital, especially a government hospital. Okay, go to a government hospital for follow-up. All right, there are certain tests that have to be done to ensure that your dad is free. And if he's not free, there are some other drugs or medications that can be given. All right. So another person is asking a question on the screen in the comment section. I'm going to show it now. Okay, so the person is saying ulcer and too much fasting is synonymous. But how can an ulcer person that still wants to fast manage it? And what lifestyle, not drugs, can help us prevent or manage ulcer? Okay, I'll advise the person who asked this question to go to our Facebook page. Okay, I once took a seminar on the 25th of last month. We held a seminar on peptic ulcer disease, and I talked about with the preventive measures how to prevent ulcer from occurring. Okay, I talked about that. But for the sake of this presentation or of this session, I'm going to answer you. Ulcer and too much fasting is synonymous, but how can an ulcer person that still wants to fast manage it? Now, there are two types of peptic ulcer. That's what it's called. There are two types of peptic ulcer disease, or we can say three types. But for the sake of this session, we're going to talk about two types. Two types. One is gastric ulcer. Gastric ulcer has to do with the stomach. Duodenal ulcer has to do with the intestine. Okay, duodenal ulcer has to do with the intestine. All right, so fasting and ulcer. When your stomach is empty, does not have food, the hydrochloric acid in your stomach does not have something to digest. And so what it does is to start, especially if a bacteria is present, especially if a bacteria called H. pylori is present, has already damaged some parts of your stomach. Okay, acids goes in and begins to cause havoc. So my advice, if possible, except you have so much of a strong faith. I've had people say they have ulcer and they got healed after some prayer. Some even say they got healed in the midst of the fasting. But I encourage you, if you're going to engage in fasting, let it not be long hours. God sees your heart and He knows what you're passing through. I mean, the ulcer. God sees your heart and He knows that you want to engage in this fasting exercise. So I encourage you to shorten your hours of fasting. Ulcer is a wound and the wound has to get healed. Okay, the wound has to get healed. If the wound is not healed, then there will be no healing. All right, and fasting is one of the things that prolongs ulcer. So I usually advise patients when they come to stay away from fasting for some time. Okay, allow your body to heal. Allow your body to heal. Allow your body to heal. And that's by doing what? Eating small meals frequently. When you eat small meals frequently, you will discover that your body will get better. So what are the kind of foods as ulcer patients you have to stay away from? You have to, at least for the meantime, not forever, at least for the purpose, for the meantime, okay, for the meantime, when you know you're having ulcer, there are certain foods you have to stay off from. One, peppery foods, spicy foods. Okay, peppery and spicy foods. That's one. Two, soft drinks. Okay, soft drinks. Three, acidic fruits such as lemon, lime, grape. You stay away from such acidic fruits. Okay. You're asking what lifestyles can help us prevent and manage ulcer. So, lifestyle number one, reduce your fasting period. If you do from 6 to 12, nothing will happen to you. You can do from 6 to 12 and then try and eat something. Okay? Try and eat something. for the period of time. It's not forever. Let your body heal itself first of all, and then you can resume your fasting, but not so long a time of a fasting. Please take note of that. Two, stay away from spicy foods, stay away from peppery foods. Okay, stay away from spicy foods, stay away from peppery foods, stay away from acidic fruits. I talked about them, like lime, like lemon, like what's it called? Grapes. Okay, stay away from them. Even sometimes orange. You stay away from orange because it contains what we call citric acid. Okay, and oily foods. That's how to manage it. Stay away from oily foods for the period. Then snacks, fried stuffs, fried egg, fried yam, fried this, fried that. For the period of time, it's important that you take medications. Medications will help you in getting healed faster. Now, the period in which you're taking the medications, you can also try to do what? Carry out these practices. So I will just go to the other question. For the person who asked this question on ulcer, please check the Facebook page. I talked more on it. Just check the Facebook page for lecture on ulcer. Okay. So someone asked a question again. Is it normal for a lady to see her period twice in a month? Is it normal for a lady to see her period twice in a month? Well, that depends on your cycle, okay? That depends on your menstrual cycle. The normal menstrual cycle is from 21 to 35 days. Normal menstrual cycle, that is range from 21. That means if your menstrual cycle is 21 days, it is normal. If it is 22 days, it is normal. If it is 23 days, it is normal. If it is 30 days, your menstrual cycle is 30 days, it is normal. If it is 31 days, it is normal. If it is 32 days, normal. 34 days, your cycle is still normal. 35 days, your cycle is still normal. So, somebody who has a menstrual cycle of 21 days is likely to see her period twice that month. Okay, twice that month. So the question, is it normal for a lady to see her period twice in a month? Yes, it is normal, depending on your duration of cycle. Okay, depending on your duration of cycle. Remember that 21 days is 3 weeks. Okay, is what? 3 weeks. So if Sister Mary started seeing her menses, saw her menses on the 1st of July, and the menses flows for a period of 4 days. So 1 to 4 days. The cycle has started, okay? 1 to 4 days. So 1st to the 4th of July, she saw her menses and it stopped. Okay, so the cycle continues to the 21st of July. So you discover that she saw her menses when? On the 1st of July, and still saw her menses on the 21st, 22nd, of July, that kind of thing. So it is very, very possible to see your period twice in a month. All right, so I'll be moving up from that question. Another question: can fibroids dry when a woman enters menopause? The answer is yes. Fibroids can dry when a woman enters menopause. Okay, it can dry. The hormone or the chemical in women that is implicated in as a cause of fibroid is the estrogen. Okay, is the estrogen. The estrogen is a feminine hormone. So at menopause, the level of estrogen in women reduces, I talked about menopause last time on I posted it. I said menopause happens usually from 50 years in women. Sorry, some experiencing from 40 years upwards. 40, 41, 42, 43, 44, 45, and all that. So as they get to that age, the level of estrogen, which is the feminine hormone, reduces, and the fibroid stops growing, and sometimes it can shrink and go. So yeah, it is very, very possible that a woman's fibroid dries, excuse me, or stops growing after she enters menopause. So I've done justice to that. Remember, it's an interactive session. It's a question and answer session, rather. And I would love to All right, sorry, I'm back. I'd love to answer your questions on health. So, someone is asking a question here. Let me check the comment section. Someone is asking, say, most times at night, it is difficult for me to see clearly with light. Okay. Most times at night, it is difficult for me to see clearly with light. Before now, I could at least see things dimly in thick darkness. But now, the reverse is the case. Sometimes also, I get this sense of instability in my vision, like a wavy sight. I don't have difficulty reading tiny characters. Okay. Does all this suggest any form of disorder? All right, so it's possible you are having some not disorder. Okay, now the person who asked this question, not it's not a disorder. It could be an eye issue. Okay, we'll call it refractive error. It could be a refractive error in your eyes, and my advice for you is to see the optometrist. Okay, to see the eye doctor. What you may be surprised, what you need is just an eyeglass. Okay, yeah, you can see tiny characters. Okay, you can see tiny characters, but there are still other things that you cannot see. You see dimly and all that. So you should see an eye doctor quickly, very, very quickly. Your sight is important. Your eye is the light of your body, okay? And you don't want to lose the eyes. So tomorrow is what, Saturday. Monday, you who asked this question should try and ensure that you go to see the eye doctor on Monday. Okay? It can be taken care of. The eye error could be corrected, the refractive error could be corrected using eyeglasses. Okay? Using eyeglasses. I wear an eyeglass sometimes. It was during my, if you have questions, please, I'm expecting you to ask them in the comment section. If you have questions, ask them in the comment section. I'm waiting for you. Ask them in the comment section. I'll be waiting for you. Ask them in the comment section. I'll be waiting for you. So, like I'm saying, all you may need is just an eyeglass. Okay? All you may need is just an eyeglass. While I was in my final year, during my final year exams, I discovered that I could not see the PowerPoint clearly from where I was seated. I was seated far and I couldn't see the PowerPoint clearly. I had to come close. If I had not gone close to the board, to the screen, to the projector screen, I would have failed that exam, hopefully. But because I did, I I I I went closer, I was able to see the board, the screen rather. So you who asked this question, your problem may just be an eyeglass. Sorry, an error which can be corrected using an eyeglass. So please try and see an eye doctor. Okay, try to see an eye doctor. Any more questions? Any more questions for this session? Any more questions? If you have questions, let me see them in the comment section. Don't shy away. Okay, so if you have questions, let me see them in the comment section. Let me see them in the comment section. Um, the person who asked the question on prostate cancer still asking more questions. He said the father went back to the hospital and complained. The doctor said that they should do CT scan of the brain. They went for it, they prescribed drugs, yet no improvement. They conducted some tests, yet nothing happened. Okay, they conducted some tests, yet nothing happened. And long story cut short is that they're unable to find out the root of the headache. The headache is affecting his eyes. The eyes keeps swelling up. Okay, I believe I'll attend to this person on a private note for me to get what she's saying fully. So it's a question and answer session, and if there are no forthcoming questions, I guess that we have tried for tonight. I guess that we have tried for tonight. If there's no forthcoming questions, I guess that we have tried for tonight. If there's no forthcoming questions, but if you have your questions, I'll be waiting for them in the comments section for you to post your questions in the comment section and I will attend to them. But in the absence of further questions, I believe that you who are watching me, you are doing well, and I guess you have learned a lot from everything I have tried saying here, ranging from prevention of kidney problems, what to do with menstrual cramps, what to do when you're having menstrual cramps, how to prevent it. Okay, if you have pain, what to do when you have menstrual cramps. Okay, and I've also talked about ulcer, how to manage ulcer, all right, how to manage it. You should avoid fasting if you're having ulcer. Okay, there are certain things you need to avoid, certain things like peppery foods, you need to avoid them. Oily foods, you need to avoid them when you're having ulcer. Okay, for the person who's having eye issue, quickly go to see the eye doctor. I believe that it can be taken care of. It's a small issue. Yeah, it's a small issue. You can be treated all right. So please try to see the eye doctor, you who are having eye issue. Okay, so it's like nobody is asking question again. All right, so maybe let me wait for 2 minutes more, and if I get no further questions, then we'll have to draw the curtain here. Remember, your health is very much important, not just to you, to God. Okay, it's very important. As you are here in this world, God wants you to fulfill your ministry. And you have to be healthy to fulfill your ministry. Take water. If you are just joining me, if the only thing you tapped from this session is that you should drink water, please tap it very well. Drink water. Take water. Women, at least 8 sachets of water in a day. For men, at least for women, at least 6 sachets of water in a day, okay, to prevent kidney issues. And for the men, at least 8 sachets of water in a day, okay, 8 sachets of water in a day. So how many sachets of water have you had today? Some people may have taken just 2 sachets of water since this morning. Some may have just taken one. And if that's the case, that's bad. Okay, that's bad. We need to look at this carefully. That's bad. All right, we need to drink water. Water is one of the freest things. Water and oxygen. Okay, oxygen is abundant. Okay, water is also abundant. God knows why He made water abundant, made oxygen abundant for us to drink. Okay, if you have to water the plants, okay, for them to grow, how about human beings? Human beings need water. So you say you came late. Can I repeat how to prevent kidney problems? I'm going to cite a few. You still have to check this session later to see how to prevent it. Okay, I said drink water, enough water. If you have any urinary tract infection, you try to go to the hospital in order to get treated. Okay, you need to get to the hospital in order to get treated. I say avoid herbs, herbal concoctions. That's what we call them, herbal concoctions. You don't know what they mixed, but they kept it in one bottle, brown in color, black in color, and say they cure malaria, they cure staphylococcus, they cure typhoid, they cure gbogbo, and they give it to you for you to take, and you drink. Your kidney may shut down. The kidney is responsible for sieving or filtering poisonous substances from the blood. But if you don't take care, okay, if you are such a person who gulps and drinks any kind of agbo, okay, herbal things that come on your way, you are racing towards what? Kidney problem. Are you have somebody around you taking alcohol, your father, your mother, you need to stop it. You need to desist from it because it can cause kidney issues. All right, it's almost 9 p.m. And in the absence of further questions, I think I'm going to call it a night here. Thank you so much for joining us this evening. Thank you for participating. And God bless you. I pray and ask God to help you to pay heed to all that I have said here this evening. Thank you for participating. I really appreciate your presence here. Thank you. God bless you and good night.